Depression affects nearly 18.4% of adults in the U.S. It is a serious, systemic medical condition, not a temporary emotional slump or a bad week you can snap out of. Because of that, standard professional care, specifically medication and psychotherapy, has to be the absolute foundation of your treatment. This is a clinical flowchart showing how you build upon that foundation. The standard of care sits on the main branch, but it splits off into 13 adjunctive natural therapies. These are tools designed to support your primary medical treatment, not replace it. When you look at all 13 nodes at once, the sheer volume of lifestyle changes is overwhelming. Managing a clinical diagnosis is hard enough without having to track a dozen new daily habits. This brings us to the core paradox of depression recovery. The condition directly causes severe avolition, a profound loss of drive. You lack the exact motivation required to initiate the habits that would actually help you. To solve this, we need to evaluate these options through a practical lens, an energy ROI model. Success does not mean adopting all 13 remedies on day one. It means taking the severely limited willpower you currently have and investing it selectively into the interventions that yield the highest clinical mood return based on your current capacity. This chart is our clinical ROI quadrant. We are plotting these interventions based on the physical energy or cost they require on the x-axis against the clinical evidence for mood improvement on the y-axis. Let's start by plotting exercise in the top right quadrant, representing high physical effort and high clinical return. The clinical data shows that higher intensity modalities, specifically mixed aerobics and strength training, yield the most significant improvements in depression symptoms. The physical exertion forces your body to release serotonin and dopamine, while measurably reducing systemic inflammation. Dietary changes land right next to exercise in that same high-effort, high-return quadrant. A depression-combating diet requires actively incorporating fish, olive oil, and whole grains, while cutting out processed foods. Consistently maintaining these eating patterns is linked to significant, long-term risk reduction for depressive episodes. But here is the pragmatic trade-off. Both diet and exercise demand immense physical exertion and planning. If you are dealing with acute avolition, getting out of bed to meal prep or hit the gym is a nearly impossible barrier. While exercise and diet offer the highest biological payoff, their high barrier to entry means they are best viewed as long-term targets rather than your day one starting steps. If your energy is at absolute zero, you need interventions requiring minimal physical exertion. Things that demand only 10 to 20 minutes of passive listening or controlled cognitive focus. Watch the chart update. We are plotting meditation, breathing exercises, guided imagery, and music therapy in the top left quadrant. These tools directly activate your parasympathetic nervous system to physically calm the body. When you practice controlled breathing, you increase your heart rate variability, or HRV. A low HRV is clinically correlated with severe depression, so raising it provides tangible relief. Meanwhile, cognitive tools like guided imagery and meditation force your brain to anchor to the present moment. This actively disrupts rumination, the exhausting, repetitive negative thought loops that keep you trapped.
Over time, these practices have a measurable impact on specific regions of your brain, particularly by calming an overactive amygdala. The trade-off is duration. The barrier to entry is extremely low, but the relief is short-term. You have to commit to strict daily repetition to alter your baseline brain chemistry. These low-effort mind-body therapies are the optimal first-step interventions for exhausted patients. They give you measurable neurological relief with almost zero physical energy expenditure. Now we look at interventions where you outsource the effort to a practitioner. This requires a different type of investment, financial cost, and logistical planning. The scatter plot places acupuncture, reflexology, and massage in the bottom right quadrant, high logistics and cost input with highly variable clinical outputs. These therapies work by releasing tight muscles and promoting deep physical relaxation. The evidence levels within this group vary widely. Acupuncture has strong clinical backing as a safe adjunct for depression, whereas reflexology currently lacks high-quality research. The real barrier here is logistics. Booking an appointment, traveling, and paying out-of-pocket expenses can feel insurmountable when dealing with severe depressive fatigue. Then there is the final category, herbal remedies and supplements, like saffron, St. John's wort, and omega-3 fatty acids. While these over-the-counter options might offer mild chemical relief, they carry significant, often hidden risks. Natural does not mean safe. Many of these herbs can severely interact with prescription antidepressant medications, like SSRIs. Because of the logistical barriers of physical therapies and the medical risks of unregulated supplements, you should not attempt either category without explicit planning and a direct consultation with your primary care provider. Taking on all 13 of these therapies at once guarantees burnout. Instead, you need to sequence your approach, matching specific tools to your primary depressive symptoms. This chart is our clinical protocol matrix. The left side lists the primary symptom profile, and the right side maps it to a targeted adjunctive protocol. Let's map the first profile, a patient dealing with low energy and severe fatigue. Their prescribed protocol includes music therapy, breathing exercises, and pet interaction. This specific combination gently raises baseline HRV and provides low-stakes social support, demanding almost zero physical cost from the patient. Next is the patient experiencing high anxiety and rumination. We prescribe guided imagery and yoga for this profile. These practices force the mind to anchor to specific physical sensations, breaking the exhausting loop of negative thoughts. Finally, we have the maintenance and optimization patient, someone who has regained their baseline energy. You have to view these tools as a ladder. Start with the low-effort interventions to gradually build the energy reserves you need to eventually execute the high-effort ones. And remember, every lifestyle protocol must be cleared by a healthcare provider to ensure it safely complements your existing medical treatments. Standard professional care remains the non-negotiable foundation, but by strategically sequencing these natural therapies, you can accelerate your recovery without exhausting the limited energy you possess right now.